Patient insurance is part of the patient's demographic chart. So we have already opened our patient's chart, Rachel Zane, under Patient Register. There are, of course, other places in the application that would access patient insurance, and you'll know that by the presence of the umbrella icon. Now, in the case of Rachel here, we see her umbrella is gray and white. That means that currently she has no insurance record present, so she may either be a self-pay or the insurance has just simply not been entered. Once the insurance has been entered, we will see the umbrella change to a red color. So I'm going to go ahead and click on that umbrella to open the insurance screen, and we're just going to go ahead and give Rachel some insurance. Now, starting in the upper left is a type field to describe the insurance type. This is a user-definable list if you need to capture that for any level of reporting. Rachel is a PPO, so we're going to go ahead and choose that. Now, for the insurance company name, you'll notice that it's one of our autocomplete master file fields, meaning I can start typing the name of the insurance. And if I see the one I want in the list, I can simply select it, or I can click the binocular, which allows me a broader search. So in this example, I can look for all the Aetnas, and then here I can maybe tell that she has the one in California. I'm going to go ahead and choose that one. Now, the only required element to save an insurance record is the insurance company and the subscriber ID. You, of course, can obtain all of these other pieces of information as relevant for your specific patient. Some insurances are group related and need the group details. Others may not. Local policy would, of course, drive what is required in those regards. But in the case of Rachel here, I'm just going to go ahead and enter a member ID. We have down here the defined as. Now, our defined as is, in the case of health insurance, you can think of it in terms as your coordination of benefits, whether it's going to be their primary, their secondary, or their tertiary. But prognosis also handles special billing cases and the defined as indicator, such as DME billing, motor accident, personal accident, and workman's comp. Now, if you are not using our practice management in prognosis, you probably do not need to worry about these additional ones here, and you can stick to the primary, secondary, tertiary. In this case, we're going to give Rachel some health insurance, and it's going to be her primary. Now, all insurances will default as active and can be associated in the system to an encounter or to a claim. Once it is flagged as non-active, it can no longer be linked to any future encounters or claims. Now, you'll notice we also have the attorney and adjuster fields. Now, this is going to be covered more in the case management module, but if there is an insurance-specific attorney or adjuster, you can certainly associate them at this level. Also, on the right-hand side, we have an effective from and up to date. This is not the same as marking the insurance as inactive, but rather when a specific policy's coverage is effective. And that, of course, interfaces over to the practice management module when it comes time for rebilling. The relationship of the subscriber to the patient will always default to self. You can change that accordingly, whether it is the spouse's insurance, the parents, etc. Now, notice that this relationship is tied to this secondary section, which is your subscriber details. When the relationship says self, the subscriber details are grayed out because it will default from the patient record. As soon as you choose a different value in that relationship, these fields become enabled so that now you can populate it accordingly. We're just going to leave Rachel as her own subscriber for training purposes. Now, if we've added all of the appropriate details, we can simply go ahead and save our record. And as we do, and the screen refreshes, notice in my table in the lower left, I now have my Aetna insurance. Notice right above my insurance grid now also where default insurances are defined, my Aetna has defaulted as her primary default. Now, in Rachel's case, since she only has the one insurance, it automatically is the default. In cases where a patient has multiple insurances, however, whether it is multiple health insurances through oneself as well as one spouse, or maybe they've been in an auto accident or had a workman's comp claim, but also sees you under their health insurance. In those cases, you can decide in the drop downs which insurance should be the default primary so that when a claim is generated, it is going to drop under that insurance. To finish up Rachel's insurance, down here in the lower right, you'll see we have a place for the insurance card image. And we can have both the front and the back. Now, we have two options for getting the insurance card here. One, we have a card scan option. If you have an OCR card scanner installed to your computer, you can simply put the insurance card in your feeder and it will come in automatically. Or in our situation, we're going to go ahead and click the paperclip because we have scanned a copy of the insurance card. And now we're going to attach it from that scanned image. I'm just going to browse to my directory where the insurance cards are. And I'm going to just go ahead and choose Rachel's insurance card. Now I did the front. Now I'm going to choose the back radio button and bring in the back of the same insurance card. I'm going to go ahead and save my record. Now, for those of you who need to see the insurance card in the future, notice there is a magnifying glass. So you can either scroll through the little thumbnail in the limited real estate, or if you click the zoom, it will open in full screen. Now, if I go back to my patient register and refresh, you'll notice now my umbrella handle has turned red to indicate that Rachel has insurance. Now that Rachel has her primary insurance, let's go back in and add her secondary insurance. So I'm going to just click on the umbrella. Notice when the insurance loads this time, it's defaulting to the Aetna. So in order to add a new record, we want to select a blank line down here in the lower left in our insurance table. If we were to simply start typing, we would be overwriting the Aetna information. So I'm going to choose the gray line. For our insurance company, we're going to say that her secondary is Medicaid. So I'm just going to type it in using the autocomplete. Remember, of course, you can use the master search. And I'm just going to go ahead and make up a number. Now, since this is Rachel's secondary and it is not a group plan, I'm not going to worry about any of those other fields, but I am going to change my defined as secondary. Patient is the subscriber, so I'm simply going to save it. Notice upon refresh, it has automatically defaulted in now as my secondary insurance. Now, one thing we did not cover with the Aetna is pre-authorizations. So while I have the Aetna selected, I'm going to come up here to my pre-authorization number, hyperlink along the left-hand margin. To enter an authorization number, I'm simply going to enter the number. It is free text. If the insurance makes it specific to a charge code, you can add that charge code. If you do not know what it is, you do have the master file search of our CPT HCPCS master. Many times the authorization number is not related to a charge code, so that is not a mandatory field. You can go ahead and enter the from and up to date for the pre-cert. We're going to go ahead and say that this is only valid for an emergency room visit on the date of the accident. So we're going to enter that it's only good for one visit. They have not used it yet, so we're simply going to skip that, and we'll just put for the MVA ER visit only. But for demonstration purposes, I am going to go ahead and enter a second authorization number. Let's say that after the emergency room visit, they've decided that they are going to cover therapy as well, and they're going to cover that for 3 months. So we're going to go ahead and enter 3 months, and we'll say 15 visits. And we will call that therapy. So I'm simply going to save that. Now when we go back in and select our Aetna, notice my pre-authorization number now has a display. We have the authorization number as well as the up to expiration date and the number of visits. Now, of course, it is only displaying the first one that I entered, even though it saved both of them. Now that initial used is relevant when you are first converting over to prognosis practice management and you have an existing PMS system that has open authorization cycles on it. That allows you to keep track of patients who are midstream within their authorizations so that you do not have to use both systems in reconciling a patient's pre-certs. Normally, that initial use column will not be applicable. Now, you'll notice over here on the right-hand side, we have a counter as far as used, appointment, and balance. That is based upon booking appointments and assigning one of those applicable authorized visits to that appointment. Then it would count it down under the appointment column. Once the appointment is arrived, the encounter's completed and closed, and the claim is completed and billed, then that becomes a used authorization. So whether it is used or appointment, it will be considered no longer available, and that is why the balance will count down. Now, the authorization is specific to the payer. So this one was on my Aetna. If I choose Medicaid, notice I do not have a pre-authorization. So in review, patient insurance is accessed throughout the system using the umbrella icon, which is color-coded as to whether or not there is an insurance record present. Your insurance master file will be based upon your EDI clearinghouse if you're using the prognosis practice management, or it can be locally defined. Local policy will dictate exactly what fields are required when populating the insurance, whereas the subscriber ID is the only mandatory field. There is a defined as indicator, which allows you to define the coordination of benefit level for your health insurances, or to indicate what type of accident insurance there is involved for injury cases. Each insurance can be activated or non-active, and this is different from the policy effective dates with regards to whether or not you will be able to use the insurance. The insurance table will hold multiple payers per patient. This also allows you to designate which insurance should be considered primary based on the coordination of benefit indicator. And when working with an insurance record, it will be reflected by a blue highlight as to the one that is in focus. You are able to maintain front and back copies of the card, and there is also a pre-authorization calculator stored at the payer level. That concludes this video within the series. Please click the appropriate link below for your next step. If you'd like to take a quiz, you will receive your results in real time directly on the screen so that you can see how well you've done. If you answer incorrectly, the system will prompt you with the correct response. In addition, a confidential email will be sent to the education team to help us better serve you with our educational offerings. Second, advance to the next video within the series you're currently in. And finally, return to the video library main page. As always, feel free to contact us through the Resource Center or email with any additional questions or comments.